Hello everyone, Dr. John with today's Headache and Facial Pain Institute. In this video, I want to cover the new patient consultation visit. The purpose of the video is number one, to introduce you to the consultation appointment and also to prepare you so that you can get us the information that we need so that we are better prepared to be able to give you some advice on self-management and some answers as to why you are suffering with head pain problems. All of that starts with the headache and consultation patient information form. This is the form that we are going to email to you. You can fill it out in digital format online. You can print it and fill it out and bring it with you if you'd like. But I really stress that it's important for you to fill out this form accurately and completely, because the more information you give us, the better the answers that we can give you back. So before you come in for your visit, also take the time to reach out to your dentist and see if you can get us at least a jaw x-ray or dental x-rays from that office. Reach out to your primary physician and see if there's any information in regards to any sort of treatments that you've had that they can send over to our office, particularly if you've had some physical therapy, PM&R treatment, injections, any sort of treatment for your neck, shoulders, or head. We want to know about that. If you've had MRIs or CAT scans of your neck and head, we need to get those summary reports, the radiology summary reports. We don't actually need the tests themselves. We need the radiology reports with the summary from the radiologist so we can see what has been diagnosed along the way. If you've seen a chiropractor, massage therapist, any other treatments that you've had done, we want to know that. Again, the more information you give us, the better the analysis that we can make. When you fill out this form, please take your time and focus on the fact that we are giving you this form based on the history of any symptoms that we list on the form. So let's say that your dentist sends you here because you had an appointment and you had a dental procedure and now you can't open your mouth, and that is like your primary concern, but you've had a history of headaches or migraines for a long time. If you don't list that stuff, we're not able to connect the dots. So you see, what happens now could be related to symptoms you may have had a long time ago that it may have resolved or not resolved. But when we list all of the reasons and all of the symptoms on this form, we are connecting the dots between what is happening now and what may have happened in the past, even if it was 30, 40, 50 years ago. So don't just list what's bothering you today again. List anything in your history that has been a problem, from headaches and migraines to jaw pain, ear pain, visual problems, chewing pain, whatever's on this form. Please check it off. Next, when you see a condition on here such as sleep apnea or sleeping problems, if you have sleep apnea, you wear a CPAP, or you may have just had the diagnosis and you're not wearing a CPAP, please bring us any sort of sleep apnea test results that you have. Send them over to our office so that we can see what the results of those tests were done. Because if we provide some form of treatment for you, we have to take into account your sleep and how your jaws position themselves while you are sleeping. Therefore, any sleep apnea diagnosis you may have had becomes important for us. Next, one of the most important things that we have to cover is what we call paranormal activities, bad habits, clenching, grinding, chewing a lot of thin vegetables or crunchy food. A lot of people come to our office and we ask them if they clench and grind, and they say no. Then we tell them, please go home, take a couple weeks and pay attention to whether you're clenching or grinding. Make yourself some sticky notes or some reminders and really pay attention, especially if you have a stressful job, especially if you're under a lot of high stress and you're in a high stress profession. A lot of times you're not going to pay attention to your body. You're not going to pay attention to clenching. You need to take the time, especially during the daytime, to figure out if you have those bad habits. Now, at night, you're not going to know what you're doing, but you can pay attention to your morning hours when you wake up. Are you sore when you touch your temporal muscles and your jaw muscles? Are you sore in your neck? Do you have worse pain in the morning, worse jaw pain, worse headaches? Is the morning a bad time? That usually indicates that you're clenching or grinding. So if you start paying attention to that now before your visit, we'll be able to give you some better self-management advice. Jaw injuries, neck injuries, whiplash accidents, even if they happened 20 years ago, a lot of those injuries slowly accumulate problems over time. We need to know that. Orthodontic treatment includes braces, Invisalign, appliances, anything that you may have had to straighten your teeth or your jaws out, whether you were 6 years old or 50 years old, we need to know if you've had those type of treatments. If you can remember anything about the specifics of those treatments, including the use of elastics or appliances, that would be important. If you've had recent orthodontic treatment, if you can bring those records, that would be very nice because we can take a look at that and see what's going on with your jaws and teeth. If you chew gum, stop right away because gum is one of the first things that we tell you to stop chewing. Gum basically abuses your jaws and your teeth. Just the way thin vegetables and the type of foods that you eat, we need to know that. Even if you stop chewing gum and you were chewing gum maybe in your teens or in your 20s and you don't do it anymore, we need to know because that tells us the type of damage that you have been causing to your jaws. Any type of medications you're taking now, or if you have a list of medications, please bring those with you. We need to review your medications. The last part of this form, there are different questions and different categories that we like to cover because we have to know everything that you've been exposed to in your life. We need to know your current stress level, any psychological disorders. We have to give you an opinion as to the efficiency of the treatment and the efficacy of the treatment that we're going to provide for you. So it's important that you fill out these categories correctly. For example, if you've had strep throat infections or mononucleosis, the kissing disease when you were 18 years old, we need to know that because a lot of those viruses, and particularly strep bacteria or the herpes family virus bacteria, a lot of them do not leave your body. They metamorphosize and they stay in your body. They can affect your neurological system, your circulatory system, your muscles, your ligaments. We need to know about that. So please really go back in history and think about whether you had any of these sort of medical problems. If you have been out of the country, if you have been around a lot of animals, birds, hamsters, dogs, cats, if you have them in your house, as many of us do, we want to know that. Of course, we're pretty much all aware of the fact that parasites can cause people to clench and grind. If you've been out of the country, you could have picked up parasites that we don't have in the US. If you have animals in your house, your chances of picking up parasites is very high. And there's a lot of buzz right now about parasites and cancer and health issues and all of that. So it is a category that we like to look at. We want to see if it is a causative factor, and it's important for you to give us that information. Next, if you've been diagnosed with Lyme disease, a lot of patients that have Lyme disease will have headaches, can have jaw problems, breakdown of the jaw joint bone. Those are effects that may never go away. If you've been bit by a tick and you've never had a blood test or been diagnosed with Lyme disease, please fill that out as well. We want to know that. If you have a history of working in older buildings, or if you have lived in homes that have had lead, or have had a leaky roof, or water damage, we are looking for mold toxicity. We are looking for chemicals. We're looking for heavy metals. They can affect your health. They can cause headaches. They can cause all kinds of problems. We have patients that don't have TMJ or jaw joint problems, and we find a mold toxicity issue, one that just hasn't been looked at. So it's important that you think about that and let us know when you come in. If you've worked in factories, auto shops, if you've driven a truck or worked with petroleum products, if you work at a gas station, we're looking for environmental toxins. We're looking for exposure to certain chemicals that could be affecting your health and causing you some pain issues. Even if you worked in a dental office or medical office where there are disinfectants and other chemical solutions, we look at that, of course. If you eat a lot of sushi, or if you've been exposed to heavy metals, if you live close to a factory, those are other factors that we have to consider. Root canals, silver fillings in your mouth, just like eating tuna, they can give you exposure to heavy metals such as mercury. So that's one of the reasons we want to look at your dental history. If you've had a lot of antibiotic therapies in your lifetime, antibiotics can definitely change the bacteria in your body. Antibiotics can cause overgrowth of yeast. A lot of patients that we examine have problems with what's called oral thrush, or an overgrowth of yeast, candida, fungus in their body. And those type of problems can cause anything from digestive issues to mouth problems, to pain, fibromyalgia, different type of issues. Remember, this is your first brain, and your digestive system is your second brain. They work together. So if you have heartburn or digestive problems, or you've been exposed to different chemicals, or you have a fungal overgrowth in your body, those are things that we have to carefully look at, because they will affect either your treatment or your health overall going forward. Now, again, factories, chemical distribution plants, it's important that we know if you've been living or if you work in one of those areas. If you drink alcohol, you smoke, we all know that's going to affect your health and maybe your treatment to a certain extent. If you eat a lot of vegetables, and I'm talking about particularly mostly our vegetarians, if you eat a lot of vegetables like lettuce and spinach, celery, fine foods, crunchy things like nuts, that makes you use your jaws and your teeth excessively. And what happens when you use your teeth excessively, you're using your jaws excessively, and you are creating stress to your joints and the cartilage in the jaw joints and the muscles and the ligaments. So if you want to give us a 7-day diet type of log and write down the things that you eat for about 7 days, not only do we look at your nutritional level, but we also look at the type of foods that might be affecting and quote unquote abusing your jaws. So it's important for you to think about those things before you come for your appointment, and give us that feedback. Now, when you come in for your appointment, we're not going to provide a diagnosis for you, but we're here to give you, number one, a lot of self-management type of advice. We're going to give you different routes of treatment that you may want to consider. And we're going to give you a lot of education so you can truly understand the causes of any sort of head pain problem, whether it's migraines or headaches or dizziness or vertigo, Bell's palsy, trigeminal neuralgia, jaw pain, throat pain, anything you may have. We are going to provide you with some basic guidance and some self-management advice, and we are going to give you some really good idea of what type of treatment options you have. So be prepared for this appointment. Be prepared for us to give you the advice, but be prepared to fill out the paperwork and give us as much information as you can, because the more you give us, the better we are able to help you. So look forward to seeing you for this consultation appointment and getting you back to a healthy and pain-free lifestyle.